So for our next session, we have a keynote session by Dr. Jerard Maria Selvam. He is the Additional Director of National Health Mission, Government of Tamil Nadu, and he has been specially recommended by even the Managing Director of the National Health Mission, Government of Tamil Nadu, to highlight the initiatives undertaken under the NHM in Tamil Nadu. So I am sure he will provide us more useful insights, and we would come to know about on the policy front what Tamil Nadu is doing on the healthcare. So I'd like to welcome Dr. Jerard Maria Selvam to please come.
So, good morning, everybody. So, I'm really happy to be part of this event and to be able to meet everybody and share some of the perspectives from the government of Tamil Nadu side, how health and IT or the technology front have gone together. I have a few slides to present, and maybe the certain experiences we have gone through all along, which automatically brings certain insights and wisdom, can be very well shared in this forum. And I also leave it to the audience to interact. So with certain things which have been in the back of my mind, I have prepared few slides. And of course, any other further discussion may be mutually helpful. Yeah. So, enabling healthcare with technology. The first slide, I would like to talk about healthcare delivery and healthcare system is undergoing a significant transformation. And for a health system, for policymakers, for governments, for health systems across the world, we have to cope with this rapid transition. So, as long as rapid technological advancements keep happening, the healthcare also is really competing with the other interests in the field of technology. So where do we stand, all of us? Today, we stand at the intersection of the healthcare and innovation, which has got a lot of power to revolutionize how well the healthcare can be accessed and provided in a more and more better way than what it is now. So that is what makes the situation very demanding, because you can always improvise, you can always make improvements on your technology, and your healthcare will always be better. However, as we all set on this journey, it is very important and essential to recognize what are the different challenges that are strongly embedded in the current healthcare system. So the challenges across the country, including Tamil Nadu, will always be to look into certain important aspects, which are your accessibility, cost factor, whether we make a change. Even when we provide free services in the government, we should also look at the out-of-pocket expenditure. So it is very important in any form of expenditure which patients sometimes incur. The cost factor, the access issue, how the data is put in, how the data is generated, how the data is managed, and what do you mean by quality of care? What is the benchmark for the quality of care? What is that satisfaction level we often talk about? The agencies, organizations, different agencies work on the patient satisfaction. What does it really mean? So the purpose of innovation and technology, we need to always embrace new solutions and improve upon it in order to transform the healthcare. So how do you enhance the accessibility? Technology is a very good tool which can bridge the geographical gaps, connecting patients with the providers even remotely. Telemedicine is a buzzword. Everyone talks about telemedicine these days. So like when you talk about telemedicine, you can talk about the e-Sanjeevani teleconsultation services, which has been operationalized through the National Health Mission across the health and wellness centers in the sub-center level. So that is one innovation, a very simple innovation, which is reaching the benefit to the remote corners of the country. where patients within the area of the subcenter can have a consultation and which prevents them from avoids travel on their part to the nearest PHC. So that is how the technology has to be looked into the context of people's situations. So in Indian context, which varies from state to state, we have to have a larger view of how we put this accessibility in the right perspective. Reducing cost. So efficient gains through the technology. How the technology can also be cost effective? That is the question. So and remote monitoring can help contain cost and make healthcare more affordable. So when we talk about monitoring, we often think of a physical monitor. The monitoring context varies. In a clinical setting, patient is monitored. And the patient's general outcomes in chronic diseases like non-communicable diseases, in that context, unless and until acute emergencies set in, normally patient can be very well monitored over a long period of time. Because when we talk about NCD, we talk about long-term care. So there it doesn't mean a close critical monitoring. So all these things are the ones which we have to critically look at, which can reduce cost. Data management. Electronic health record or electronic medical record, whatever we call about, is a very, very important tool. But how updated is the EHR, electronic health record, how well updated it is, and how it seamlessly takes in the continued clinical data of patients and patient movements. Patient moves from facility to facility. It could be from government to another government facility. It could be from government to private or private to government, because we don't have a control on people's movement. But the visits made by the patients can be of different types. Yet, it is one and the single patient and one and the single data, one and the single body, one and the single health. So that is how policymakers, if the governments look at the person. That is the philosophy. That is the wisdom behind using a technology. So for a private driven provider, it will be more of within their margins, within their objectives, ambitions, they will look at a patient. But for a government system, it looks at a patient's movement as part of his health episodes, which probably starts from the time a fetus is conceived to the time we are declared dead in some place. Could be a hospital or a home. This is all life. It's all life about. So if this is all life about, the healthcare system also looks at the life about situation and tries to put the IT technology in the correct perspective. What do you mean by the quality of care? Now, a lot of things are coming. It is very attractive. If you go anywhere, people use the word artificial intelligence. Now, artificial intelligence is an evolving field. It's too early to jump on the board, but it is a welcome. It's a welcome. For example, Tamil Nadu government, we have introduced a robotic surgery, which happens in the Omadur Hospital here in Chennai. Now, this is one concrete example. But overall, there are a lot of implications behind artificial intelligence. Data privacy, data management, a lot of issues are there. So even when it comes to handling the patient's data, there are a lot of things which we are accountable to the patient. So as a IT, when we are using the IT platform from the government side, we seriously take into consideration what we should do with the data. And we have to protect the data, and the data should be protected in terms of the security for the patient. So artificial intelligence I touched upon, and when it comes to surgical modality where you want to have the precise and personalized care, very precise technology where you involve cancer therapy, a lot of AI definitely comes into picture. Because in cancer therapy, you talk a lot about a very, very, very micro level, very specific level, very organ, within the organ, a very specific site-specific treatment. So when they focus on such things, definitely the AI technologies are bringing in values, which I don't deny. But at the same time, it's too early to be upbeat, to start with about the AI. Now, if you take about our National Health Mission, some of our initiatives like laboratory information management system, LIMS, and also the sample transportation system, because you don't have to make the patient move from one place to other, you can transport the samples, but it should be linked to the IT application. So all that is again cutting the cost, it makes it accessible, it improves the quality. So over and over, if you go through the same titles, you should connect them with the services provided and the technology provided, and you should question each aspect I have shown in this slide. So that is how I am looking at all this IT is all about. So going to the next slide. Healthcare delivery in Tamil Nadu, a lot is talked because Tamil Nadu has got a very robust healthcare system. So a lot is talked, well known across the country. So we have a very good network, a very well developed public healthcare system with your PHCs, primary health centers, hospitals, medical college hospitals, and it does provide. Undoubtedly, it does provide accessible and affordable healthcare for its people. And you have certain platform which we call the Health Management Information System, HMIS, and linking to the citizen, which is called the PHR, which my earlier speaker mentioned, sirs mentioned about it. So you have got your HMIS, your population health registry, which I've shown as a broad foundation in the picture there. And you have lot of applications which have to be ideally going into like a puzzle piece. It should go into the basic platform, which is your HMIS. So that is the vision, that is the wisdom of operationalizing your health activities with technology by government system. So the next point is I would like to touch is always you have to prioritize preventive and primary care if you want to run any health system, for that matter, for any government. So the more investments made in this area is very important. Earlier speakers are also mentioned about the strategy for behavioral change. So those which they said that in their project, they're doing it with the John Hopkins, it's very important, but many times it can be kind of like not really looked into. Because behavioral change is all amounting to changing your lifestyle and bringing additional benefits to your own health. Easily said than done. So the strategies are definitely needed to work on them more and more in the times to come. So this is just a kind of a slide to tell you it's a long story from 2007 onwards. So it's such a long story, and somehow or the other I have been witness to a lot of these developments. But then in a presentation, we can't say everything, but in one or two slides, I would like to say, HMIS as a history from 2007 onwards, when it started with the World Bank supported Tamil Nadu Health System project. Now it is called Tamil Nadu Health Systems Reforms Program, from where Sir and his team have come. But at the beginning, we used to call it as TNHSP, which initiated the pilot on the HMIS. Though that went on for about a long experience. And then up to 17 we had that. Then we had to go for the second version of the HMIS, which is in place now. We are also going for the next version, HMIS 3.0. So when I say all these versions and years, what is the carry-home message for all of us? HMIS for health is always dynamic, and it can never stop with one vendor. It can never stop with one application, and there is no a permanent solution or a version which is going to suit all times to come. So that is the experience of the states. That is the experience of countries, that they learn in a hard way the ifs and buts of the managing your HMIS. So it basically, what is the aim of your health management information system? It should capture the real-time data. So real-time data, a very strong and robust connectivity, a very good connectivity, and a very good, smooth and easy to use application is all matters to call it in a true sense real time. That will be always a challenge even for developed countries. So we have this operationalized in DMS and DME institution. That means your GH and medical college hospital, because that is where the patient care in huge number happens. With the primary health centers, we use the basic modules. because the number of patients catered to is less compared to your secondary care. And your reporting system, which is the MIS part, is integral. University part is there because of the MGR Medical University and the college is affiliated, the college management system. So all these are put together in your HMIS. Now there are different modules. I will not bore you with the things, but it looks like from the point patient comes, where you have the OP registration, and from there you have patients have different places where they can go. They can be an inpatient, they may go to laboratory, radiology. When they are admitted, they have a laundry need. The waste generated have to be also managed. That is the biomedical waste. The diet you provide to the patient, clinical care you provide, super specialty clinic you provide, you refer, and all these things tell you that how HMS, technology-driven HMS, has to take the complete events which are connected to a patient, whether he or she is a OP patient or a IP patient. So, in the MIS modules, you have this clinical information, ancillary support services, administrative information, and also the program. Because National Health Mission takes forward activities for betterment of health through its various national programs. So you name it, you will have the national program. It could be TB, NTEP, National TB Elimination Program. It could be a leprosy program. It can be non-communicable disease program. It could be vector-borne diseases program. It could be any other programs which you commonly hear about the national programs. So they are all, so in terms of health system strengthening, the National Health Mission and Tamil Nadu Health Systems Reforms Program and the JICA supported projects, all this are like your blocks, the blocks in the building blocks, like building blocks, they actually anchor and strengthen the health system. That is how it is perceived. So the routine departments are there, routine health system activities have to go, which you can never stop. But the building blocks which connect them and strengthen the health system happens through all these initiatives which I mentioned. So the college module, I already told you, like that was academic needs. So we are right now we have got about 67 medical college and connected hospitals, 297 GH, and all these things, they come under the health management information system. LIMS, lab information management system, which I told you, so that patient don't have to go to the other lab. You can collect the samples and you can generate the result from the another point, and you can take out the result in another place. So all these things are very important. And the PHCs basically give the MIS part. They report on their activities, which is called MIS, Management Information System. When it is real-time clinical oriented, then it becomes a patient-centric real-time data. This is another interesting picture you see here, the umbrella Population Health Registry. What is it all about? Here we try to, basically I'll explain in a very simple way. For all the healthcare services, you need a common denominator. So what we do is, you link a patient as a citizen and you allocate a number, which you call as the UHID, Unique Health Identification Number. So by doing that, what do you achieve? In the beginning of my presentation, I told that we have to look at a person's life as a life cycle. From the time conception to death, you go for various needs. First time the mother goes with the child inside a room. Then the mother goes after the child is born to the thing. Then the child grows into adult and walks into life. Goes through all the troubles of related to health. All these things, if you want to really see whether it happens in a private or a government, wherever, you need to connect to a number. That is your population health registry. So this needs a little mapping exercise down to the street level, so that this becomes, so this becomes an important tool for handling patients in the long run. And this is one important application. And then the other one I would like to touch upon is your, some of the important applications already Sir has mentioned, so I will not go over it again. The pygmy, which we told about, which tracks the mother, pregnant mother, and also the child after it is born. Then the registration and also certain benefits we give to them, everything is monitored through this technology called pygmy technology. Makkalai Thedi Marutham is a flagship program of the Honorable Chief Minister of Tamil Nadu, which you have heard a lot, where we provide home-based services. One of the important aspects which I'll touch upon here is these home-based services where we provide drugs at home, we provide physiotherapy, we provide palliative, and also deliver the peritoneal dialysis bags. These are important services which are also again connected by way of technology to a portal which we call as MTM blind list portal. So we have this one of the robust and a very strong portal, I think one and only of its kind in the country right now, where all the line listed NCD patients you can access through the portal and you can follow their progress, control rate and referral. So RBSK is another important innovation. The state has gone ahead by coordinating with the education department so that the teachers in the school education department can put in their own application, TN school education department application, the children who need attention, and that is in collaboration with our RBSK, school health program doctors. They are able to capture that information because there is an interfacing between the two applications. There is a sharing of this important things between the two applications. That is an innovation on the part of Government of Tamil Nadu, which enables early interventions for the school children. So this is what I was talking about, the EMIs, Education MIS, Tamil Nadu EMIs portal integration with your RBSK. So in conclusion, this is my last slide. I'm going to wind up now. So we need data. We don't need data in pieces. You need to have a comprehensive health data management. And you should be able to also look at the surveillance point also. You should be able to have an early identification of the health events in the community. Not only the individuals, also the profile of health events in the community. What are the important interventions we have to act upon? The targeted intervention, that data-driven decisions, that is an important. What is the health outcomes of what we are doing? We have to look at our own performance. What is the health outcome I am achieving? And monitoring and evaluation, health technology as a monitoring and evaluation tool, and data-driven decision making for policymakers and for the implementers equally important. It is not only for the government and the policymakers to look at it, but the implementing bodies in the field, they themselves have to use their own data to tell them where they stand, where they do not stand. So with these few words, I finished my presentation. I just said, as I said earlier, from what was in the back of my mind, I try to convey certain things in the angle of health and technology. Hope it was useful for everybody. Thank you.
Thank you, sir. And very conclusively, 3 points which spoken in terms of the data-driven insights and then monitoring and evaluation it on a regular basis, and finally the outcome based. These are the 3 important points. So before we conclude our inaugural session, I would request Sangamitra Mohanty, co-founder and director of APAC News Network, to hand over a small token of appreciation to our speakers. Thank you, sir. With that, we conclude the inaugural session, and it was a pleasure having both of you.